Are we on?
You're on.
Is it recording?
Yes.
Oh shit.
That's it.
It says record.
Great.
All right. Well, I'm Dr. Dirk Farrell. I'm here in Yelm with Meggan, who is a massage therapist, and our goal today is to have a conversation and answer a whole bunch of questions that she has about advanced biostructural correction and the work that I do, that her clients have, that she's referred to me have about advanced biostructural correction, and hopefully make all of this make a lot more sense for everybody. Is that right?
Yep. Excellent.
Awesome.
Thank you.
Well, what do you want to know?
Well, first of all, I'm blown away by this work that you're doing, and we're all very, very grateful. First of all, because it's kind of blown my world. 2 months ago, I found you, thanks to everyone bringing it to Yelm. Thank you, Jessica. And I noticed I've been giving a lot of clients, sharing this work with my clients, and that's really exciting for me because I've been doing this about 22 years, and I know a lot of different modalities, and I really am passionate about helping people to a deeper degree, and I'm seeing where I'm limited, where massage in particular is limited. Mm-hmm. And I'm always looking for the next deeper way to help people on a deeper level, not just for today, for lasting change, for their vibrancy of their life, to be the best they could be. So that's where you come in.
Right, and that's a great fit for me because my interest when I became a chiropractor 25 plus years ago was not in chiropractic per se. My real interest is in healthy longevity. That's the thing that matters.
Of course.
So what are the pieces that I need to bring in to have healthy longevity happen for myself, for my family, for the people that I care for and take care of in my office. So it happens to be that advanced biostructural correction, which I was introduced to about a dozen years ago now. It kept me in chiropractic practice because I was going to leave otherwise, I think. And it's just revolutionized my understanding of what's possible for people's well-being.
Beautiful. So that's one of the questions that I had, and I've been seeing through my clients and hand-holding through the process to get the best results that they could possibly get or receive. And the one question is, having to do with what's the difference between this work that you're doing ABC and what is ABC technically, and what's the difference between that and normal chiropractic care?
Yeah, so there's a lot of types of chiropractic. There are 100 plus techniques in chiropractic. Some people use an activator, a little device that gives an impact. Some people use a drop table that the table falls away when they push on them. Some people use just other kinds of hands-on manipulation. There's many different techniques in chiropractic, and advanced biostructural correction is another approach to chiropractic work. It's another approach to aligning the structure in the body so that it works better. The difference between advanced biostructural correction and everything else is that advanced biostructural correction only moves things that the body cannot move in the direction the body cannot move them. That's really, really important. So in the body, bones move in lots of directions. Let's just take the spine for right now. In the spine, the bones bend forward, they bend backwards, they bend sideways, they twist. But if they slide forward, there's nothing that can pull the bone backwards. There's no muscle, there's nothing solid behind my back that a muscle attaches to that pulls it in that direction. And that's really a key principle that was discovered by Dr. Jesse Jukowitz about 27 years ago now, I think. And it's so important because anything that pushes us forward, our body can't correct. So you notice over time, everybody ages like this.
Yeah, and that's what we're programmed to think, that we have to accept that.
Exactly.
And that you just move forward, and this is how, this like you get older, you're going to have arthritis, everyone's going to have knee pain, everyone's going to look like a humpback, Right. So this is what it's very interesting to me because I'm seeing such fast change when even myself, through this process. But let me ask a question with that regard. What do you feel is really the reason why vertebra or bone structure would move forward towards the front of the body and create that? Would it like a fall? Would it be just normal, looking at the phone, or Exactly. What would it be?
It's gravity.
gravity. So slow
It can
movements.
be slow, it can be fast. Somebody can give you a hug and they can pull you and you can feel your bone go forward and pop. That could make you, just somebody being loving, that could pull that bone forward. And it can be looking at a phone like this. You can see my head's going forward, my neck's pulling down. The bone up here, the first bone, C7 is the first bone. It's the base of my neck. That's the first bone that can go forward that the body cannot pull backwards on its own. So this gets dragged forward. The upper back gets dragged forward. If I'm bending backwards over things, it kind of can push this backwards. If I'm doing sit-ups and I'm doing, yanking my head forward, that can pull all of this stuff forward.
So we're pretty fragile.
Well, we're incredibly resilient.
Yeah.
But that structural piece is somewhat
Key.
It's very key, and correcting it is incredibly helpful. And that's why when we push these bones back, it's not just that one bone that goes forward. It's not like something happens and, oh, well, the top bone in my back, T1, gets pulled forward. Everything above it also goes with it. It's just like a stack of boxes. If you've got a bunch of boxes and you push the bottom forward, how many of the other ones go in that same direction? All of them.
All of them, yeah.
It's not like, oh, this one stays where it is, and this one slides. No, they're all attached to it, right? They're by gravity, so they all slide forward. So that's what happens. The bone slides forward. It happens to be that nothing's like perfectly flat, so it slides forward and slides forward, and then it tips down and it actually twists.
And then people are like...
And now they're like this until somebody comes, and then something compensates.
Yep, and then the muscle
So it
tension.
looks like they're okay.
Yep.
But until this gets bone pushed backwards and everything else above it goes backwards, and the compensations can never let go, and they add up over time and make people more and more sore and achy, and they do all sorts of other physiological damage to the body.
So this protocol, this technique, this style of adjusting the structure, how is it much more lasting or much more permanent than a normal adjustment, let's say?
So in my experience doing ABC, yes, you're restoring something much more to a normal position. For me, this is not about moving something around to make it feel better. This is about actually bringing the posture to be into a more stable position in place. And because of that, when people also learn things that we'll talk about on another video about standing, sitting, and sleeping and how they use their body on a regular basis, then they have the opportunity to have this last. But at the same time, it's also a process to unwind the body.
Yes.
Right, so I call it unwinding because the bone goes forward and it twists, which literally winds the body. So if a bone here twists the slightest bit, everything above it goes with it. You can see my whole body's going.
So it's not just going forward. That's very
Not just
important.
going
That's very
forward.
important to know. So it's not just going forward, it's going forward and doing a rotation.
Yes.
So that's because a lot of that was one of the questions is, what is the unwinding? You're like, moving like this,
Right.
so people, when they come in, what do they expect? The first one, in my opinion, not to scare anybody, but
Right.
it's a little intense. The
Right.
first one's a little intense. I tell people, hey, get ready. The clavicle, right? That gets a little intense, wakes people up. But also, immediately, a rush of energy comes, and you have more ability to breathe deeper like never before, which is exhilarating. And also, so each session is different, I notice, and I've been going through it my own process just to know, because I was interested. Not that I didn't come for it. And that was another question really that I wanted to touch on is, a lot of people come, I came because I just wanted to experience it, and I wanted to feel it for myself, to know it on my own experience, to then share it and be able to help people further and deeper. If I don't go through it, I don't know, right? But I didn't come because I was in pain.
Right.
See, a lot of people, they only go somewhere, or they only spend their money, or they only invest in something to get them out of pain. And what's that about?
So there's a lot of different things in there that I want to...
Sorry.
No, that's great.
Blast away.
So let me back up for a second and ask, so you didn't come with any particular symptom per se that
No.
you're trying to solve, but what have you noticed about your body since coming in for
Well,
the last 6 weeks?
a lot. So first and foremost, I'm a massage therapist, so I usually use my right hand dominant, so my right shoulder was always a little forward, having an issue, always having to be adjusted back. then it's more dominant, the muscles, so my neck would get, and then my right knee, and then I know my lower back, I had more of a lordosis, which is an exaggerated lower lumbar curve,
Right.
and my sacrum, because I believe, from childbirth and whatnot, it popped out, and it stayed popped out. So I've done a lot of different techniques and styles and whatnot, but it's interesting how this was immediate. Like on my 6th visit, you adjusted my sacrum, and I remember I said, "What did you just do?" And you adjusted it by doing something I believe was in the upper back. I don't know, was that true?
So,
Because it was amazing. And it changed my
you changed your sacrum.
It changed my whole lower
Right.
posture for sure.
Right. So, this is definitely a bit of a tangent, but every part of a human being is connected to every other part.
Yes.
We talk about parts as separate because it's convenient, right? Oh, I've got a shoulder problem, I've got a knee problem, I've got a
Yes.
low back problem, I've got a neck. But anything, unless you got stabbed with a knife or somebody threw a rock at you or something damaged the tissue at that particular level, if the pain comes on, chances are the pain, that area, whatever it is not where the problem stems from.
And that's what I deal with as well with my
Right.
work. Yeah.
So it's like walking down the trail with somebody, you're holding hands and they fall off, or you're not holding hands, they fall off, you grab their hand, they're falling, they're the problem, but you, the one person holding them, is the one who's going to get tired.
Yeah.
So if my posture is doing this, and my low back is the part that's holding me up,
It's going to be tired.
that's what's going to get sore and achy and tired. If it's my sacrum, then it's going to get tired. If it's my neck and my holding all this stuff up, then that's what's going to get sore and tired. But it's not the problem. The problem is it's doing something to compensate for something else. So by stacking all of this, by pushing these bones back in the direction the body cannot pull them on their own, we therefore just stack the body. It's upright. We can see it before and after pictures, and every time somebody
Very
gets the
quick,
ABC
very
protocol,
quick. That's
you can-
what's amazing.
Yeah, you can see their posture change, right? So that gets to the comfort, lack of comfort, etc. And for better or for worse, when I'm working on somebody, I look at them a lot like a car that's been wrecked. It's been dented.
That's nice to know.
The question is, how can I organize the parts of the car? How can I fix the dents, right? Straighten out the wheels, replace the windshield, whatever. How can I get that structure aligned again so that they work well? Because really, that's what my job is. Their life, their emotions, all that stuff is their thing, right? So some of that can be uncomfortable.
Yeah.
I was talking to a friend, and he was talking about how he knew of a woman who went to a car place to watch her car get fixed.
And she had pain.
No, well, worse. The mechanic hit the car to knock the dents out with a hammer, with a mallet,
Oh yes.
and
they
she
do
passed
that.
out.
They do that.
The woman passed out because she was so identified with her car that she thought that hitting the car was hurting her.
Yeah, well, this is our car. This is our car. This is our vehicle.
That's
for sure.
exactly right. It's just our car.
Exactly.
It's not who we are, right?
Exactly. So we need a mallet and a hammer, you
Yeah.
think?
Well, sometimes. Sometimes things just need to be done, and it's not comfortable. So, I have empathy and I have compassion for that, but on the same token, I've had 2 open heart surgeries because of a defect I was born with, and do I not want them to cut open my chest? Do I not want to have to go through the recovery to get to the other side of that surgery? The answer is, well, no, it's just what's part of healing. And for the people who don't want to go through a healing process, they're just not going to, and they're just not going to get the healing.
Yes, that's one of the points I did want to make as well, is that what is somebody, what could they expect? Is it a painful process? And I find myself, I'll speak for myself, that in the first one was probably the most intense, I would say, not painful. Again, certain adjustments, but then it's like more refinement, more refined adjustments that are not painful at all. Feel very I'm missing the word.
Right.
Actually, it's
Right.
relieving. It's
Right,
an
right.
enjoyable. Oh, finally, exactly, a sigh of relief. But just some people, because as soon as somebody may feel pain or discomfort, they may back out and say,
Right. Absolutely.
I'm not into it.
And that happens because not experiencing pain is far more important to them than getting to a better health situation in their lives, right? And that's
It's
unfortunate, but
it's
it's a reality for some people. So there are things that I do that people find uncomfortable, sometimes painful. I don't do it because it's painful, and there are other people who don't find that painful whatsoever.
Yep.
So it's not that the thing is painful, it's what's going on with a person's body in the first place that needs to be corrected is why it's painful.
Yep.
So if I have a splinter in my finger and and I can't get it out on my own, and some kind person comes along and says, here, let me do that for you, I guarantee that taking that splinter out is going to hurt.
Yeah.
Splinters hurt, right?
My son likes to keep his in.
Well, because it hurts.
Don't do it.
Right, exactly. It's going to hurt,
Yeah.
but it's a good thing to get it out so it
Yeah.
doesn't get infected.
Yeah.
But if you can't see your way through going through that discomfort, if there's discomfort for that particular movement on the body for you, having said that, my experience is that very typically when people are uncomfortable from the visit, it's usually after the first visit, they leave, they feel good, they go home that evening, the next morning they wake up, and maybe during the next day they start to feel sore and achy. And when they come right back in, we get them through that achiness right away. Because when I push things back toward normal, because you can't take something that's here, I'm exaggerating, but you can't take something here and push it here. There's all sorts of things that happen as the bone slid forward, bit by bit by bit. All the parts of your body got involved. It's very complex. But as I push things back, other things start to let go. Now we fall in other directions. It's subtle. The person doesn't necessarily know it, but we can show it on before and after pictures. And now that the body's falling in other directions, new muscles are getting involved to hold them up. And now they're like, oh, wait,
I wasn't doing anything before. I was sleeping. Now I gotta work.
Exactly.
Well, that's the thing. Exactly. Also, I've noticed it myself. Like, so my low back changed completely, right? So the low back, I think that was on the second visit, the low back, and then the sixth visit, I think I had the sacrum thing happen. That completed the whole thing. So what I noticed was then certain muscles, like my back, my erector muscles were very, very strong all the time because I was bending over, massaging. Now, other muscles were showing, I feel so now I was like, I was wanting some more stability because it has changed, right? So some people, this is another question, I don't know if it's for this video or whatnot, but what can people do to support in between the sessions? Because they get a session, maybe they're having some, the muscles are doing a little pull into, a little tug of war and trying to refigure out where they're going, a new home, right? So new home. I do that after massage. I say, listen, you're really gonna feel what happened like 24 hours after, but don't just go run a marathon now. Like you're kind of like, a little drunky, you had a little, your muscles are a little confused of where they go and they're in new places. So not just to go and, lift some heavy weights and get crazy. See,
that's the opposite I tell people. When when they're done working with me, I'm like, go run a marathon. Now your body is functioning better than it ever has before,
really?
Or at least in a long time. Now's the perfect time to go work out. Now's the perfect time to go run a marathon. Now's the perfect time.
But there isn't a window, because I kind of felt with myself that there was a window of like readjusting and finding a new.
So your brain figuring out where you are in space.
Yes,
that's an issue.
That's what
you got to figure that out. But using your body is the way to figure that out. There's an ABC practitioner in Europe, and she worked with a pro golfer who'd been pro for decades. And it took him about 4 visits, I believe she said, after about 4 visits, he finally found his swing, hit the ball again, because he kind of couldn't find where the ball was because his posture was different and his movement was different. But once he did, he was hitting it. This is a long-term pro, 20, 30 yards further, I believe, if I recall correctly.
Much more efficient.
Way more efficient, way more effective.
But there was a moment, right? Yeah. There was because I have a client that had amazing breakthrough, amazing, like on the first visit, and then went out and did golf, a whole bunch of holes of golf, and then his knees were kind of totally a wreck. And I was thinking that it was, me personally, and maybe I'm wrong, that it was the adjustment of the muscles, because the
Yeah.
muscles were holding the bones in a certain way as well, no?
No, what happens with something like that, he may have not have corrected his golf shoes, so his golf shoes could have been twisting him. So as the body gets unwound, it becomes in a more stable, more upright
Yes,
position.
I felt that
Okay?
myself. Uh-huh.
It is now more sensitive to things that throw it off.
Like the
So,
shoe.
yeah, so this is outside the scope of this video, but most shoes throw people's posture off, and they're more sensitive to it now.
Okay.
People that have been getting ABC for quite a while, they start to go, well, yeah, no, I don't want to sit on that chair and that couch.
Oh, they'll have more.
They're a
they don't feel
fine-tuned
good.
system. They're
Exactly.
a fine-tuned thing now, and they're like, yeah, I want to keep it this way because I know how I'm going to feel. Whereas when we feel crappy all the time, we don't even know it. We're just broken down, and it just becomes background noise.
Yeah.
But once we start to become, more of a racehorse, if you will,
That's right.
then all of a sudden it's like, wait, no, I can notice all this stuff that's going on, and I don't want that.
Yeah, the car seat, actually, the seats in the car drive me nuts because they actually push you. They pretend that you're supposed to be like this.
Exactly.
And it doesn't support your curves.
Exactly.
So I'm constantly away from the seat.
Right.
But yeah, it'd be nice. Anyone listening, fix those seats.
So yeah, there you go. But let's stay on the ABC process,
Okay.
for right now, and talk about that a little bit more, because
Oh, okay.
everything affects everything in the body.
Yes.
Okay. And another analogy I like to use is of a tent with a pole in the middle, right? You got wires going down to the corners of the tent, right? So if that pole's straight up and the wires are all the same tension, it's going to be just fine. But if you take that pole and you bend the pole, now some wires are going to be loose, some are going to be tighter,
Yeah.
and it's never going to stay upright. It's not going to shed water very nice, much less heavy snow or whatever like we just had in Seattle. And it's always going to be a problem, right?
Yeah.
The best thing to do isn't change the tension on the wires to match the bent pole. The best thing to do is replace the pole or straighten up the pole.
Yeah.
Well, our spine isn't replaceable, so we gotta straighten up the pole.
Not yet.
We gotta straighten it up. So when we get this straightened, all of the other stuff starts to work really well. And it really is a process. You mentioned people come in when they're in pain.
Yes.
And that is, of course, a choice that millions and billions of people make around the world. People who can afford to get care still make that choice because they think pain is the indicator that says do something. And a lot of people have pain and they don't do anything. But pain is the last thing to show up and the first thing to go away. And personally, I don't want to live my life based on the least function possible, right? I want to live vibrantly and fully, and I want my anatomy to support that, right?
Yeah.
And just keeping myself out of pain is just like, who knows? It's like keeping myself from falling off the cliff.
Yeah.
I'm always close to the edge. It's always dangerous. I could fall. It could be horrible, but I don't want to do that. And it's not a smart approach to health and well-being. And ABC, each visit, especially if you're doing the self-care stuff in between, the standing, sitting, and sleeping, as we teach about, pushes you further and further away from that cliff of structural instability where your posture is collapsing. And that's important because studies have shown that just this posture increases the correlation with dying from heart issues by 44%.
Oh, sure.
Just by
limits
this
the
posture.
function. It limits the function.
Absolutely.
And then you become jailed and caged in your own body.
Exactly.
Yeah.
All
So
the
freedom.
stress, all the
This is what I wanted to express as well, is that this brings greater freedom in the vessel in your body. This is your one body.
Right.
You have to take care of it. And I do feel, and it's my passion, is the alignment issue, that I feel that really there's not a lot of education out there for teaching posture. Back in the day, hold a book on your head,
Right.
hold a teacup, be a lady. But ultimately, nowadays, you're just, if you're sitting at a desk all day, that's your function.
Right.
If you're sitting in the car all day, you look like a car body. So everyone gets these things, and we're forgetting what's the reason behind why we have alignment, why we need to be in alignment to be, aligned with all.
Yeah, and that's super important because people think being upright equals good posture.
Yeah.
And it doesn't necessarily. I can show people who look upright all the time and whose posture is lousy and who've got all sorts of dysfunction. Their spine might be really straight,
Yeah.
and they look like they're upright, and they are, but that doesn't mean that their system isn't under bad stress.
Yeah,
Right?
It's amazing.
Yeah.
It's amazing. And I have clients as well that are very fit, very healthy, you think, and then you climb in and you're like, whoa,
Right.
a lot of stuff hiding, a lot of compensations going on. Oh, one thing I did want to bring up, which I think is important, in the email and whatnot, is mentioned that there's a meningeal adhesion release. Just for everybody to know, because some people don't know what a meninge is,
Right.
and what's the release, and kind of what that looks like, and why they need it, and how do they know they need it.
Right.
Yeah.
So the meninges are a topic unto themselves, but the meninges are a Spider-Man-like web that surrounds your spinal cord and your brain. Okay? It is incredibly strong stuff. You could take a meninges off of a cadaver and you can tie it to 2 bumpers and tow 1 car with it. It's super, super strong protective material. And so inside the spine, you've got a canal, a space in the bones where the spinal cord goes, and it's surrounded by the meninges, and it's supposed to protect the spinal cord and then allow for movement. And the meninges is also attached to the spine at the different levels. So meninges are actually a structural element. They actually, when your body is structurally sound, and your posture is good, your meninges are what are holding you up. That and your calf muscles. You don't need any other muscles to hold you up.
Really?
Which is why when I work on people and they feel lighter, no matter how much they weigh, they feel lighter when they're done. It's because their muscles are no longer working to hold them up as much, because they're more upright. So the meninges that go through the spinal canal and around the brain, as the body moves, they rub against bone or other tissues sometimes, right? Because things aren't in their normal relationships, and they get damaged, and then they scar up against the bones. And sometimes those meninges are stuck and they will not allow the bones to get pushed in the direction or move in the direction that they need to be corrected. So surgeons have figured out that there's meningeal adhesions in the lumbar spine and the low back, and they will go in there with a scalpel and they will, break up the scar tissue on the meninges, between the meninges and the bones, or the meninges and the spinal cord, but mostly the meninges and the bones on the outside of the meninges, and they'll have some good results.
I've heard that, by the way. Is that the same thing when people, I've had people with stenosis, which is the narrowing of the spine. I've heard of that particular, where they take out, and it's actually like a plaque or a
So
calcium.
stenosis, they'll take out some of the bone to make more space, but that's a different issue than this.
Okay.
But functionally, this leads to a syndrome called tethered cord syndrome.
Okay.
And tethered cord syndrome is when your spinal cord, that's the cord that's being referred to, is actually being stretched because it's stuck in various places and the posture is pulling it over the bones to make it stretch. The problem with that is it changes nerve function.
Oh yeah.
When you look at the symptoms of tethered cord syndrome, they're basically synonymous with aging. A gradual onset of aches, pains, etc., etc. And so you can correlate tethered cord syndrome and aging and many of these things that happen with the posture.
Interesting. Yeah, and so that might give people the feeling of maybe like being, strangled and whatnot, and the tension that they have for no reason. And they just don't know why, but they have this anxiety underlying their life. What about headaches and stuff? Migraines, people because I think that would be number one, meningeal, I learned in craniosacral about the meninges, 3 layers and whatnot, and beautiful, and how to release them as well, but this is completely different.
Yeah, so that's changing the pressure on them. It's not really releasing the adhesions. Adhesions are strong.
Got it.
Think Gorilla Glue and Gorilla Tape. They're really, really strong, and there's no way you're going to get them by just, this is not going to release adhesions.
Do you mind me asking how you release that?
We put the body in certain postures and stretch the person so that it tethers the spinal cord. It's kind of like if I had a piece of tape on here.
Yeah.
Okay, and it was stuck to this, but I didn't have the room to pull it this way. If I pull the tape tight enough this way, it's going to separate from the wall.
Yep,
Okay.
yep.
And so that's essentially what we're doing. So it's a very specific stretch, or different stretches depending upon where it's stuck.
Okay. Because I don't think you did that on me yet.
I don't know that I have.
I don't know.
But it's a significant part. I've had 2 former pro soccer players, both that never thought they would run again because of knee issues. Within 6 weeks, go back to running, and not just a little bit, but run.